In India, more than 4 million people suffer from some form of dementia. I am Dr Sandeep Nayani. I am consultant neurologist, Apollo Hospitals, Hyderabad. Today I am going to talk about dementia and some of the myths that we commonly come across. So dementia is a disease of brain where there is shrinkage of the brain that happens in some individuals, especially in elderly people, which results in forgetfulness, inability to carry out their routine activities, losing track of things like time and place, and eventually becoming dependent for all their daily activities. So some of the common misconceptions or myths that we see in people about dementia: father or my mother has dementia, so I will also get dementia or Alzheimer's. No, that's not the case. It doesn't happen that way. Dementia is not very strongly genetic. There are some types of dementia which, when happen at a young age, can happen in their progeny or in the children also. But usually dementia is not a disease that spreads from one generation to another generation. It is not a disease that if it is there in the parents, it will come in children as well. Usually it is multifactorial. It happens due to multiple factors like age, environmental exposure, diet, educational status, level of mental activity. All these can contribute to brain health as well as to development of dementia. So it is not purely genetic, or genetically it doesn't happen in all generations. The second misconception or myth that we come across with dementia: all dementia is Alzheimer's. No, that's not the case. So Alzheimer's disease is only one of the types of dementia. It is the most common cause for dementia, but there are other causes of dementia as well. So Alzheimer's disease happens with age due to brain shrinkage. However, there are other causes of dementia, like brain strokes can cause dementia. There can be accumulation of fluid in the brain that can cause dementia. Brain infections can cause dementia. And there are various other types of dementia. There are types of dementia that can happen due to vitamin deficiencies and thyroid deficiency in the body as well. So Alzheimer's is not the only cause for dementia. The third common misconception: I am forgetting things, I have dementia or I have Alzheimer's. No, that's not the case. Forgetfulness is a very common symptom. We all forget things at some point of time due to multitasking, due to mental stress. We all may forget things at some point of time. So all forgetfulness is not dementia. We call it dementia when forgetfulness is so profound that we are not able to keep track of the daily activities. We are not able to finish a task, or we are forgetting things that happened in the morning by afternoon. And this kind of forgetfulness is interfering with the routine activities of daily living. Only when that happens, we call it dementia rather than any forgetfulness. So dementias do have treatment. So once we find that someone has dementia, we have to find out what is the cause of dementia, whether it is Alzheimer's or whether it is related to brain stroke or whether there is any other reason. So once we confirm if it is an Alzheimer's disease, there are certain medications which can improve the memory and improve the patient's functioning. Although Alzheimer's is not completely curable, there are medications available which can treat the disease and give some benefit to the patient. Thank you.